Eve Catchall 984 asks, a fair amount has been written about estrogen and cardiometabolic health in women. How about men? Is low testosterone an independent vascular risk factor or more a biomarker of poor metabolic health? I love this question. I love talking about hormones. Okay, so yes, estrogen is a cardiometabolic risk factor in women, or the loss of it can result in worsening cardiometabolic biomarkers for sure. And it's one of the things I love helping women with as they're in peri and postmenopause. Low testosterone is certainly associated with poor cardiometabolic status. There are a few studies that do show that testosterone replacement therapy to physiologic, not super physiologic, not gym bro gear levels, but like physiologic levels can, in some studies, help reduce the insulin resistance biomarkers, help prevent progression to diabetes. There are other studies that show very little impact. I don't know whether this has to do with the patient population, the dosage at which the testosterone was administered. What I will say is that it's important not to ignore the impact of estrogen in men. We actually don't talk about this enough, and especially in men who are being treated for aggressive prostate cancer with androgen deprivation therapy, that is also by virtue of the fact that the only estrogen in men comes from aromatization of testosterone. It is also an estrogen deprivation therapy in men. They get menopause with a mustache. They get hot flashes and night sweats. They get excess subcutaneous fat. It's actually not as much visceral fat, which is interesting. Anyway, and bone loss, osteoporosis, and fracture risk in men. And you can safely replace the estrogen without replacing the testosterone. And for some men, this is life-changing in terms of their quality of life. So estrogen is also important for men, and it's a male hormone. I use testosterone replacement to manage symptoms. I am not as bullish about it as some of my other colleagues in the sort of lifestyle, longevity, prevention, wellness space. People who come to me and ask for it, we can talk about it, but I don't push it. I never go out of my way to suggest it. I'm not sure that I believe in it that strongly as a marker for, or as a lever to move the equation for cardiometabolic medicine. But I think if people have low libido, low energy, and are not able to do the things that will, in fact, improve their cardiometabolic status, especially exercise, especially getting out of the house and getting some sunshine and some time out in the big wide world and doing their social connection and doing what drives them to be happy and fulfilled in life. If those things are not working well for whatever reason, I am open to a trial of testosterone replacement to see if that makes any of that better.